Good afternoon, folks, and welcome to today's live stream. We'll give folks just a minute or two to continue joining, and then we'll go ahead and get underway. Okay, why don't we go ahead and get started? Good afternoon, everybody. My name is Gabriel Spitzer. I'm part of the communications team at Public Health Seattle and King County, and I'm really pleased to be moderating a panel today that includes Brad Finegood, Strategic Advisor for Public Health, Dr. Scott Phillips, who is the Medical Director and Medical Toxicologist for the Washington Poison Center, and Dr. Marlo Murray, who is also a longtime pharmacist there. Thank you all for joining us. This is a really important subject that we're taking up today. We want to talk through some really accurate information about the threats from fentanyl and why it's in fact safe to give aid and assistance to somebody who might be experiencing an overdose. And we're going to talk through some of the science, some of the policies, and some of the trends that we're seeing locally here in King County. So to start out, I would love to talk to you, Dr. Phillips, a little bit about what it is about fentanyl that makes it such a concern. Why are we talking so much about it in this context of health and safety of our community?
Okay, well, thank you, Gabriel, for the kind introduction, and welcome to everybody that's joining us today and after the fact on the stream. Fentanyl has become a real wave of drug issue in this country, and King County and Washington State as a whole is not immune from this, and we're seeing it every day, and every day in the Poison Center we see cases involving fentanyl. Fentanyl is problematic because it's an opioid drug, like an opiate related to morphine. It's probably 100 times more potent than morphine. And so that means very small amounts of it give the same effect as a larger amount of morphine, for example. So only 100th of the amount of fentanyl was equal to morphine. So that means a couple of things. One, small quantities are easily transported into the country or produced, but also that small amounts can cause a lot of potency issues. Likewise, these very potent medicines we use in the hospital sometimes for pain control in cancer patients and others. But it's also being used quite commonly on the streets now and widely available in very large amounts. There's a very large seizure that just happened this week, actually, of an extremely large amount of fentanyl in New Mexico. And it's a problem because of its potency, and medications and drugs that you purchase on the street obviously do not go through purity testing. So we don't know how much is in each of these tablets, powders, liquids, for example, depending on what it is. And so we don't really know what the dose might be, where medicines that are prescribed to us by our providers or that we get at a retail pharmacy or hospital, those medicines all go through strict quality controls, and that's just not the case on the street. And that results in this very significant potency, and unknown amounts can result in very significant overdose and a lot of overdose deaths. And that's what we've seen in the United States, and including Washington State, in the past couple of years, is a significant increase in poisoning events as well as poisoning deaths. And Brad's going to talk a little bit more about that as we go on here.
Yeah, thank you. So this very potent, highly dangerous, and widely accessible drug. Brad, can you talk a little bit about what the trends are in King County in terms of fentanyl's spread and how accessible it is to users?
Yeah, thanks, Gabriel. It's really interesting. As we've tracked fentanyl trends here in the county and nationwide, there's been there was a huge influx in fentanyl on the East Coast for, the past decade. But we really hadn't seen it here in Seattle, King County prior to about 2018. And one of the reasons was that fentanyl was in the form of it came in into methamphetamine and other types of heroin that we weren't seeing here in the on the West Coast primarily for many years. And then we started to see fentanyl coming in a different form. So we started to see it come in the form of counterfeit pills, which presented a whole new risk for the community. So if I can project my screen, we started to see in about 2017, 2018, fentanyl come in the form of these blue small pills that had an M on one side and a 30 on another side. And Dr. Murray, as a pharmacist, will be able to tell you that if that came from a doctor or a pharmacy, that would be like a legitimate opioid Percocet prescription. It's a generic Percocet if you were to get it from a doctor or a pharmacy or a hospital. And it's totally legit if you get it from a legitimate source, and it's totally a regulated, controlled opiate like Dr. Phillips was talking about. The problem is these are counterfeit pills that are made to look like real pills that were brought into our community and that have came into our community in just loads and waves and increasing waves that we've seen over the past number of years. So this is what we've seen. And so with the amount of seizures that we know, that if somebody gets one of these pills and it's not from a legitimate source, and when I say legitimate, I don't mean your friend or somebody like that. I mean directly from a hospital, pharmacy, or a doctor's office, that there is a huge, highly likelihood that these are counterfeit and contain fentanyl. They don't smell any different. They don't look any different to the naked eye, but they contain fentanyl, which Dr. Phillips was talking about, the lethality risk of. And we're starting to also see fentanyl come in the form of powders more and more too in our community. So people might think that they were getting different types of drugs, but actually having fentanyl in there. And so in our community, in King County, we want to make sure that people know about what's going on, and we publish our data on a fairly real time, within a day or two, of the number of people that are dying, what they're dying from. The website I have listed here, kingcounty.gov/overdose, has a link to our data dashboards on it. But you can see in the bottom left, the fentanyl involved deaths quarter by quarter since the beginning of 2018 have increased astronomically almost every single quarter. If you look on the bottom right here, this dark blue line, in 2015 in King County, we only had 3 fentanyl related overdose deaths. So when we did a lot of work around our heroin and task force earlier in 2015, our major overdoses were from heroin and prescription opiates. We only had 3 fentanyl related overdoses. You can see the amount of overdoses that have increased, this hard blue line, due to fentanyl. Last year there was over 390 fentanyl related overdoses. So that is growing astronomical. It has almost doubled year over year. Last year there was 200 more overdoses than in 2020. So we've seen this continue to grow and continue to be a huge threat to our community for a number of reasons. The high lethality risk, as Dr. Phillips was talking about, but also the form it's coming in. People often aren't able to tell that it's a counterfeit pill with fentanyl versus a legitimate prescription.
Yeah. Thanks so much, Brad. I should mention, by the way, that we're gonna this discussion will continue for another 10 minutes or so, and then we'll have plenty of time for audience Q&A. So if you have questions, comments, things you'd like to know more about, please go ahead and put them in the comments section, and we'll get them relayed to our experts. With fentanyl spreading, as you just described, Brad, it's unfortunately become really, not uncommon to come across somebody who may be experiencing an overdose, whether it's in public or in the line of work or whatever. And a lot of people have concerns about, what that means. What should they do in that situation? And particularly, is it safe to help someone in that situation, or could they in fact be exposed to fentanyl just by helping, by giving rescue breathing, by giving CPR, whatever the case may be? And it's it's a thing that we have seen from time to time in the media, on social media, or just among rumors. These stories of responders, interveners, people trying to help, who then get exposed to the drug themselves. So we wanted to talk through a little bit about how risky is it to help someone who's experiencing a fentanyl overdose. Dr. Phillips, medical toxicologist, could you talk through a little bit about what risks, if any, there are in that situation?
Yeah, thanks, Gabriel. This is really a hot issue and has been for a number of years. And with the frequency that we're seeing fentanyl now, it's only
I feel like this
increasing.
hard to. There he is.
Dr. Phillips, I'm so sorry. We lost you there for a couple of moments. Would you mind repeating um, pretty much from the beginning what you were just saying? Sorry about that. I'm so sorry. I'm having trouble hearing Dr. Phillips. Can other folks hear? You might be muted. Dr. Phillips, can you hear us? Oh, okay. Well, hopefully we will get Dr. Phillips back in the queue here in a moment. But Dr. Murray, as a pharmacist and someone who's been with the Washington Poison Center for many years, um, what do you want to say about the risk potentially of secondhand fentanyl exposure from someone trying to help someone who's overdosing? Oh, and I see Dr. Phillips, you're back. Can we hear you now? Can you say
I,
something?
I hope so. Sorry about
Okay,
that. It's
great.
always the internet like sneaks in as a little gremlin and sideswipes us. Yeah, so I was saying that fentanyl does not absorb well through the skin in this powdered form. So if people get it on their skin, you just wash it off with soap and water. Pharmacists handle this medication. We use it in the hospital. We just don't see that really happening. And there has been studies done um, by the National Institute of Occupational Safety and Health, part of CDC, looking at whether actually this gets absorbed. And there's also been numerous position papers by, for example, one of our toxicology physician organizations, specifically addressing this with first responders, police, and hospital workers. And there really hasn't been evidence that it causes an effect when it's just exposed to the skin. Now, a second concern is, what about the smoke? What about the secondhand smoke if you think about it that way? So, secondhand smoke versus firsthand smoke, first of all. Firsthand smoke is where the smoke is coming off of the burning substance directly. Secondhand smoke means it's been filtered through a person first. And fentanyl is very lipid soluble. It likes to get sucked into the body and into the brain, and that's part of the opioid effect. And so when people smoke it, it tends to stay in their body, and very little comes back out in smoke, and virtually no concentration that causes any health concern to people. Primary smoke is even a smaller amount, but it's not really a health concern. Now, one of your big questions was, well, what do you do? Is it safe? And the answer is yes, it's safe. When you're doing CPR, you're not inhaling from the person, you're actually blowing air into the person. So you're not going to get that exposure from the person. So we recommend doing exactly the same thing that you would with any unresponsive person. So I recommend you should be prepared. You should have Narcan available. You should have CPR training. And you should approach this like any patient, because we don't know that this is fentanyl, right? We don't know that it's heroin. We don't know that it's not a stroke or heart attack. So you should be prepared with a little first aid background, CPR training, and have your Narcan there just in case it happens. And you can save lives by that every day, and it's important.
Yeah, thanks, Dr. Phillips. And so just to put a fine point on it, it is not a significant risk to get exposed to the drug when you're helping somebody who may have overdosed on it. Is that
That's
pretty
correct.
clear? And you
Yes,
have high
that's
high
correct.
confidence in that. Yeah. Yeah. Dr. Murray, do you have anything you want to add to that? And could you talk a little bit about what you're hearing from the public as you field questions um, that come in? Is this something that people are concerned about and have potentially have some misconceptions about?
Yes, and I would just piggyback on what Dr. Phillips said. It's not going to spread around to others nearby, people nearby, if someone is using fentanyl or other illicit substances. And people are worried about this. It is a concern. We've had calls into the Poison Center from a transit operator who was concerned about an exposure to fentanyl from people smoking it on the bus while she was driving the bus. There was an incident in a grocery store where someone was using fentanyl in the public bathroom, and then concerns about going in to clean up the bathroom afterward, or other shoppers in the store who may be aisles away. We had several calls from that. They, I think, ended up evacuating the store because of that situation. We get calls all the time of people who maybe find something on the street. They want to know how to dispose of it. They want to know, can they pick it up? Or have they had an exposure just by touching a baggie, or things like that. And recently, a call from someone who had purchased a marijuana edible product and was asking, is there a possibility that this could contain fentanyl? I just want to reiterate that cannabis marijuana products that are purchased legally from a dispensary will not contain fentanyl. It is the illicit drugs that may contain fentanyl, the street drugs. And like we were talking about earlier, it's primarily in the form of counterfeit pills, counterfeit tablets. So those kinds of concerns really aren't a health issue. We would always recommend, if you see a baggie, it's best probably not to touch it. You can contact the Poison Center for assistance and resources of how to dispose of that safely, and we can give you instructions. And if you are handling it, you want to wear gloves, and first responders will be wearing their proper PPEs, just like they would for any exposure. But yeah, so folks are concerned about it, and we are getting calls about this routinely.
Yeah. It seems like people are freaked out by fentanyl, justifiably so in a lot of cases because it is so potent and so powerful. Brad, I wonder if you could just talk a little bit about why it's so important to get out like the right information about this, and to get out accurate information about what it takes to help somebody who might be in crisis.
Yeah, thanks, Gabriel. I mean, with the data that we showed and that's available, it's well and evident that the number of people dying from opioid overdose are just continue to escalate in our community, and it's super important to know that that people have tools. An opioid overdose is a reversible condition, right? An opioid overdose. I'm not a doctor, so please, I'm looking to my doctor friends on the call to correct me if I'm wrong. But from everything I know in this field and in this work, an opioid overdose is respiratory depression, right? Happens from respiratory depression. So opioids sort of sedate, and it's a central nervous system depressant. And people like start to go towards falling asleep. And then when they fall asleep, the respiration becomes less and less and less. And we know with fentanyl, because of the power of the drug, that happens so much quicker and quicker and quicker. And so people need to understand that they can do something, right? They can recognize what the signs of overdose look like, snoring when somebody doesn't snore, some gurgling, some changing tones to people's skin. And when that happens, that people can act. So because it's respiratory depression, mouth-to-mouth resuscitation, CPR, as Dr. Phillips was talking about, is something that is like, will be firsthand and first line of defense. And naloxone or Narcan is an amazing medication that really empowers people to reverse an overdose. And so all that is, and it's available in form now that looks very much like an allergy misting medication. So if you just take it and it's one dose and you spray it up somebody's nose, the great part about Narcan or naloxone is if somebody's not having an overdose, there won't be any other types of counter effects. So let's say somebody was just sleeping or passed out or something like that. There's no negative effects of giving them Narcan. but we also want to like know what we can do and know how we can address somebody who's having an overdose. We want to talk to somebody, see if they're responding first. And we understand that, you know, and it's important to acknowledge that certain communities, and especially communities of people who have been using drugs, have had some adverse experience with first responders in the past, but it's super important to call 911. We have laws like the Good Samaritan law that protects people. Our main and first interest is always keeping somebody alive. And to know that an opioid overdose is reversible. And so we in the community have the power to do that, whether it's somebody that we know or whether it's, you know, out in the community, we have that ability. And it's always best practice when either whether you're in the home or whether you go out, to have naloxone or Narcan on you, because you never know when you're going to encounter somebody who is struggling. And I will tell whoever is watching today that I have, you know, my personal experience, my brother died of an overdose. And if the person who was with him on that day would have been able to recognize the signs of overdose, called 911 when it was the right time, and or had Narcan, there's a good chance he could be alive today. So it's all of our obligation and responsibility, you know, to be able to help people when they come across somebody, because if they don't, then it might be too late and that person might end up passing away.
Yeah. Thank you so much for sharing that, Brad. Do you want to talk a little bit about how people can get Narcan?
Yeah, Narcan is super easy to get for the most part. If in Washington State, there's a standing order for naloxone, a statewide standing order. So a lot of pharmacies cover it. Most pharmacies cover it. Stopoverdose.org, just like it sounds, stopoverdose.org will let you know where you can get naloxone across Washington State. Here in King County, we ran a campaign called Laced and Lethal to let people know a lot more about the dangers of fentanyl and the forms it comes in and what folks can do. So if folks go to lacedandlethal.com, I wasn't sure if it was .org, but if they go to lacedandlethal.com, if you're in King County, you can get access to, we'll send you a Narcan kit through the mail. So Narcan should be pretty easy to get to. Most insurances cover it. If you go to your local pharmacy, it should be available without a prescription.
Thanks. I ordered mine through Kelly Ross and got it for free within like a week. So it was great. Well, I'd love to start weaving in some questions from the public now. If you have a question or a comment or a point of clarification, please go ahead and enter it into the comment section, and we'll pass along as many of those as we can. One question that's come in is probably for Dr. Phillips or Dr. Murray. What do you think is potentially causing the effects that first responders are having in these stories where we're hearing about people who attempt to give aid and then believe that they were exposed to fentanyl themselves? What do we think might be causing those symptoms?
Well, it seems like when these happen, there's a lot of emotional content associated with them. And it's a very emotional thing if you're not used to seeing people collapse or have a medical emergency like this. And we think that's a lot of what might be going on. And the people that experience this actually recover quite quickly without much sequelae at all, other than they might fall down. And so it appears that some may have some fainting episodes, but you know, as Brad mentioned, there's really no downside to giving naloxone to these people for whatever cause. And so I think that's really an important thing to remember, that even if these people appear that way, you don't know what's going on with them. So treat them like any patient. That's the important thing.
Yeah. And just to be clear, so like this is the idea is that this could potentially be an emotional or a stress response that people are having and attributing to exposure to the drug, but it might be in fact something that is simply a reaction to a very stressful and tense situation.
Absolutely. And they could be so stressful they might be having a heart attack. So that's why it's important to keep an open mind, be prepared, with the ability to call 911, assess the patient, give Narcan if needed, and begin CPR if necessary. And so preparedness is really crucial here. And, having Narcan available is just a great idea. I carry it with me as well. So.
Yeah.
And just to reiterate, we're not seeing symptoms of fentanyl toxicity in bystanders. So that's just not something that we've noted, at least in our area. We haven't had any of those cases like you would see in the media. It's not happening. So those folks, if they're feeling dizzy or lightheaded or woozy, like Scott was saying, this may be related to the stress of the situation, or there may be other substances that they're being exposed to. If there's perhaps bad odors involved, other compounds that might be present that might also cause symptoms. So, but the bottom line is they're not having symptoms of fentanyl toxicity. And it's really easy to tell if somebody is having symptoms of fentanyl toxicity. They won't be breathing. They might be passed out, not responding. Their breathing might be so slow that you can't tell if they're breathing. And in that situation, if someone is not breathing, not responding, or having a seizure, that's a medical emergency, and it's time to call 911. Whereas if you're not sure, or if you think maybe yourself, you're concerned you may have been inadvertently exposed to fentanyl, you're awake, feeling fine, talking, you can contact the Poison Center. Our phone number is 1-800-222-1222. You can call us anytime, 24 hours, and we can walk you through the next steps and what to do, what symptoms to watch for. But if it is a medical emergency, if someone's not breathing, it's most important to call 911. And I always like to remind people, if you've used Narcan or naloxone on someone, you still need to call 911, even if they wake up.
Yeah. Thanks, Dr. Murray. For both Dr. Phillips and Dr. Murray, we had another question come in asking for a little bit more information about the potential risk from exposure to fentanyl smoke. And in particular, I wonder if you could talk, Dr. Phillips, you mentioned that there's the smoke that is the secondhand smoke that has already been inhaled by a human being and had a lot of the drug taken up by that person's body, so it's not in the secondhand smoke. What about the smoke coming off of the pipe or whatever it is? I mean, if somebody is smoking on a bus, for example, it's not that easy to tell the difference between the secondhand smoke and the primary smoke of the fentanyl combustion.
Right. It's easy when you're doing research on it, but in that environment, it's really a combination of both. And the thing to think about with primary smoke exposure is that you're getting a very tiny fraction of any type of drug that might be available that's burning off of their pipe, because they use a very tiny amount when they burn it. So the actual volume of fentanyl that's coming up that would then get into your breathing zone, which is a 2-foot area around your mouth and nose, is actually very little. And so you almost have to be purposefully trying to inhale the smoke to get an exposure. So we consider that incidental exposure, and those people tend not to get any kind of adverse effects.
Yeah, thanks so much. I just taking a look at another question here, asking more generally about these accounts in the media about potential effects suffered by interveners or responders, and asking just sort of whether do we have a sense of what's going on there? Like, is there an incentive to kind of drum up more fear about fentanyl, or do we think that this is sort of just kind of a natural response to something that's new and scary? And I know that we're not sociologists here or whatever, but if you have any thoughts about that, why this is such an issue right now, and why these stories seem to get so much attention, I would just welcome you to share your thoughts.
Well, they are dramatic events, and of course, news media likes drama, and so when these things happen, it's very visible. It's with a substance that is very scary in its own right because of its potency and availability, and so it is something that we do take serious. When this happens, so you can't just discount it being, all hysteria. You really have to evaluate these people individually and see what's going on. What motivates people to do it? It's hard to know. It's probably multifactorial, many different reasons. While people might be scared, They might have some reason that they want to be in the press or on social media or some other finding. And like you said, I'm not a sociologist, and that's really a bit out of my league. But if you have someone who has symptoms, they need attention, whether it's calling our 800 number at the Poison Center or calling 911 if they're really having difficulty. Either way is the right answer.
Yeah.
I think sometimes things online just sort of take on a life of their own. Maybe the initial media source that posted a story may not have anything to do with how far and wide it spreads. So there's a lot of misinformation online, a lot of real information online, but it's not always the folks posting it who have control over where it goes from there.
Yeah.
In addition to some of the sensationalism that we've seen, or supposed sensationalism, I don't want to make assumptions about other people's experiences, but this also like really reminds me of a decade ago when there was a lot of public fear around methamphetamine, and methamphetamine was being produced locally. Methamphetamine is not really being produced much locally anymore. Most of the methamphetamine is being produced in other places and being brought in. But it really reminds me of a lot of the fear that's been that came along with, and you know, I don't like the legitimacy of those concerns are very different because of methamphetamine and all that type of stuff. But like when there was labs and the toxicity that came with the labs and the production of the labs. So I also wonder if some of this is, you know, communities sort of trauma response, if you will, to stuff that we went through 10 years ago when there was a lot more methamphetamine being produced here domestically.
Mm-hmm.
Yeah, that's really true. And we've seen this for decades, actually, with a variety of substances. And there's kind of a name for it called chemophobia, where people knew potent, scary things, whether it was benzene in sparkling water that you might remember from 30 some years ago. It has significant public health concerns for people, and there can be some panic and they're afraid, and then we're off and running. And these take a wave in the press from every few years we get something like this that happens.
Yeah. And when Dr. Dr. Murray was talking earlier about how some of those phone calls go, what reminded me of was the fear and concerns around HIV/AIDS in the early years when the general public didn't understand well how it was transmitted, and people were afraid of being in any kind of proximity to somebody who was HIV positive or somewhere that they had been, and that as you know time went on, obviously that decreased, but something so new and scary and invisible seems to generate this kind of response, if I'm not mistaken. A couple of more questions from the public, and we touched on this a bit, but again, maybe you can elaborate, Dr. Phillips. If you accidentally touch fentanyl in some form, if you pick up a pill, you pick up a baggie, or whatever other way you might encounter it, is that dangerous? Could you potentially absorb it through your skin? We talked about it not absorbing too well through your skin, but on the other hand, people sometimes get prescribed a fentanyl patch that's a transdermal fentanyl dose. So what do people ought to know about what the potential is to get exposed to the drug through their skin?
Yeah, it's always an interesting point and a hot topic. And the answer is it doesn't get absorbed to the skin to any kind of clinically important amount. So if you do get it on your skin incidentally, wash it off with soap and water. We would suggest not using alcohol sanitizers because that might change its absorption characteristics, but just simple brush off the dust, soap and water, and you're good to go.
All right. Another question from the public. This question is, and forgive me, my vision is bad, so I got to stick my face close to the camera here. But is fentanyl typically combined with other drugs? And if so, would there be secondhand or primary risk that we wouldn't know about related to the other substance? So I think that question is, yeah. So do we worry as well about potential exposure symptoms or response or toxicity from something that might be mixed with the fentanyl?
I think many users are using more than one substance. So they may have fentanyl on board, they may have methamphetamine on board or other substances on board. They may be using them concurrently or sequentially on the same day. So that's pretty common. It's also, like Dr. Phillips was mentioning, we don't know what is in many of these tablets or powders that people are buying on the street. There's no testing being done, no purity testing being done. So people may think they're using heroin. They may think that they're using an oxycodone because it looks like an oxycodone pill. We don't really know what is in there. It could be fentanyl, it could be another synthetic opioid, it could be oxycodone, it could be any number of different substances that are mixed in. So there's a lot of unknowns there, but it is a possibility that there may be other substances involved, either that someone's used along with the fentanyl or just in the fentanyl tablet itself.
And one kind of heinous thing that has happened in the last few years is mixing fentanyl with other substances, whether it be generic Xanax that's manufactured, or cocaine. There was a big blip with cocaine. And the reason for that is it creates a market. It becomes toxicoeconomics, we call it. Suddenly you've created an economic market by having people physically addicted to this substance where maybe it was just recreational before. And so it's kind of a evil kind of way to increase a market share of a product with certain dealers that might be using it. And so, yeah, you have to keep an open mind about other things people might have. And that's why it's important with preparedness. And if Narcan doesn't work, you have to be ready to go that next step with CPR and basic first aid and calling 911 and all those other things. Really important.
Gabriel, can I just say real quick that for the most part, what we have continued to see in the county is primarily fentanyl and counterfeit pills, although it has came in different forms. Fentanyl and counterfeit pills is, for the most part, just fentanyl and I believe acetaminophen. So the pills have not been mixed for the most part with other drugs. Dr. Murray and Dr. Phillips are right that there are anomalies to that. We've seen it in different forms with different things, especially in this powder form as of recently, where it might have been mixed with cocaine or some other type of substance. But for the most part, what we've seen is fentanyl in the form of fentanyl and acetaminophen.
Yeah, and those pills, if you think about it, look, these are, pharmaceutical manufacturing facilities that crank out these pills. And it's difficult to make combination pills compared to a substance with just a single ingredient in them. So the majority of these pills are going to be essentially fentanyl plus a certain amount of filler, whatever that might be, that they produce. So typically the pills are going to be one ingredient. That doesn't mean it will always stay that way, and that doesn't mean we should not be vigilant.
Yeah. One more question from the public, and then we'll probably start to wrap up. But given the increase in fentanyl in the state and in King County, this is a question for Brad, I think. Are there efforts to do more drug checking or offer more services for people to check their own drug supply to see if they contain fentanyl? Those kinds of initiatives. Do we have that happening here in King County?
Yeah, I mean, fentanyl test strips are available. They're available on the market. They're fairly inexpensive. They're like $1 a piece. People can order them off the internet. They're fairly easy to get. The law is a little bit ambiguous on using fentanyl test strips a little bit, but we know that there are. It's really important to understand if there's fentanyl in people's drugs, and there's other around the country. There's other community-based drug checking instruments that are available. We have groups like Dance Safe that have done it for a long time. And we're looking into is this something that we need to do? Because it's all about saving lives, and it's all about helping people. And it's all about, if people, are using substances, making sure that, they're as minimizing the harm as much as possible. It's really important, again, for people to identify the signs of overdose. If we can just project this slide real quick. This is a poster that we have available that people can order, again, off kingcounty.gov/overdose. But being able to recognize the sign of what does an overdose look like, that abnormal breathing, slow or no breathing, like like the doctor was talking about, gurgling or snoring, when that is something that normally doesn't happen. If somebody's, first things first, you want to try to wake somebody up. If somebody is nodding off, if they're found in an unusual position. I saw somebody who I believed overdosed on a bus. He was slumped over sideways and everything was sprawled. So obviously not being aware that he had passed out. In that case, I was just able to wake him up. So I didn't need naloxone. And that person ended up being able to walk away and be okay. But also changes in people's skin, and cold and clammy skin, different tone and to people's skin. Obviously, this is going to look different depending on people's pigmentation. But these are just signs that people want to be aware of for what an overdose looks like, because again, we can intervene in an overdose.
Yeah. Thanks so much, Brad. As we wrap up, Dr. Phillips, Dr. Murray, do you have any sort of closing thoughts on what you want people to take away if they find themselves in a situation where they've encountered someone who may be overdosing?
Well, again, preparedness, I can't overstate that enough. Being ready with being able to dial 911, to be able to call the poison center, to be prepared with naloxone and your own skills of doing CPR, I think are really important. I think the other thing to know is 911 is a free phone call, just like the poison center. It's not going to cost money to get help. So I think it's important to reach out. Let us help you make those decisions if you're not sure.
Any other closing thoughts, Dr. Murray or Brad?
Just that it's safe to call for help, like Dr. Phillips was saying. You're not going to get in trouble. In Washington, we have the Good Samaritan law that protects individuals who are calling for help if they are also using. You're not going to get in trouble for having drugs on the scene if you call for help. It's safe for you to call for help and access first responders and 911 who can assist and save somebody's life.
I'll just end with saying that, appreciating the community's impact and the ability to make changes. We know that this is a scary situation in the community, and if you are in the community, that this can be scary. But it's super important to know the facts and to know that you do have help. Stigma, or how we believe about people who are using drugs and how we feel, often is the biggest thing that's going to get in the way. And so if we can put our predisposed belief systems aside and know that we can help and save lives, I think that is really what's most important. Just a huge appreciation to Dr. Phillips and Dr. Murray for joining us today, because having this knowledge is super duper important to equip the public with.
Yeah. And I'll just take a second to remind folks that the Washington Poison Center's poison helpline is open 24/7 all the time, 1-800-222, sorry, 1222. So, have that in your phone and have it at the ready. You can call that and 911 if you find yourself in that unfortunate situation. I hope that we can keep this conversation going. Please feel free to share this stream of this widely, and keep the questions and comments coming as well. It's really important to get this information out as widely as possible so we can keep folks safe and keep folks alive. So Brad Finegood, Strategic Advisor for Public Health Seattle and King County. Dr. Scott Phillips, Medical Toxicologist, Medical Director for the Washington Poison Center, and Dr. Marlo Murray, Pharmacist at the Washington Poison Center. Thank you all so much for joining us and sharing your expertise and your points of view. And thanks everybody for tuning in and for asking such awesome questions. And we'll see you next time.
Thanks, Gabriel.